Hello again. I'm going to try part 2 of analysing the video. Well, not the video, the podcast. Sorry about the coughing. The podcast that Evans does with the Daily Mail, published on the 18th of September, episode 63, The Expert Witness. This is from 17 minutes 20 onwards. Just a few notes before that, before I start listening to him again. We start listening to him and the journalists. It's this need to persuade. It's a phrase that comes up when people are doing statement analysis. The sense that there's a need to persuade there, which the idea is, I'm not a statement analyst, but I get the concept of it. I mean, you're able to get these concepts. It's not rocket science. The idea that someone is presenting with this need to persuade you of something, and you can feel it and sense it and hear it. And so this need to persuade is him setting out his stall in every interview I've heard of him so far, to say that he knew nothing. Goes in there knowing nothing. He's saying in this one, it's a blank sheet. It's a complete blank sheet, which is a lie, which is not true. And he must know that's not true. Of himself and certainly of the police. He doesn't know her name, doesn't know Lucy Letby's name, doesn't know there is a suspect. It's all just a very open investigation to see if there are any problems there. No, nobody's thinking there's a problem at all, it could be anything. And on the other side, you've got the police giving this disingenuous thing about, hoping the expert figures out it's a bad bug in the water, which he's not looking at any of that stuff. So it's all pretense. It's all pretense. So he lays out his stall all the time. He overemphasises it. He doesn't know anything, never heard of before, never heard of anyone before. Do you see what I mean? He's just really, really laying it on thick all the time. And he does it more than ever here, because I think he knows that people are onto him. He knows they're onto him. And that's why he's even gone as far as saying it's a blank slate here. Furthest thing from the truth. Just this other note, which probably relates to something later in the interview, but I'll just say it when I think of it. The 2 insulin cases that they find later in 2018 that Dr. Breary finds later, I think they needed to find something extra. Because as Evans himself said, without those 2 cases, there's no smoking gun. And he says it's impossible to prove that anyone deliberately did any of these air embolus cases. But once you've got that insulin smoking gun one, all the other ones fall in, and then you've got to believe all the other ones then. Why? Why have you got to believe them if they wouldn't stand up on their own? If each individual embolus case doesn't stand up on its own? But you've got to believe them because then Breary finds this note about a high level of insulin, which we've talked already, they didn't do the correct test for it. There could have been reasons why it's naturally produced insulin, a whole host of arguments against it, none of which the defence thought of using. Instead, they agreed that it had been added, that synthetic insulin had been added to the TPN bags. So they didn't fight it at all, they just went with it and condemned Lucy by that strategy. Absolutely condemned her. So it was the idea that the police and the doctor and Evans knew they needed a smoking gun. Subsequent to his first report, so he's got these 15 cases, none of them are insulin. They're all this embolus idea, and physical trauma that he's got no evidence for at all that Lucy's done anything. Nothing at all. None at all, no evidence. It's just all in his head. It's in his head to back up the doctor's claims and their suspicions, and what the police want to hear as well. He's telling them what they want to hear as well. So they had to find one, and Breary supplied it. They're looking for one. They're looking for one for a whole year, and then they find it in these notes. And then that becomes their smoking gun that they're going to use to construct, to back up all these other ones which wouldn't stand. The 15 of them wouldn't stand. Wouldn't have got past the CPS, wouldn't have got to trial probably. Well, if they didn't go past the CPS, they wouldn't have got to trial. So, and he says it himself, without those 2, that was the smoking gun that proved somebody was deliberately doing something. So you could, implicit in that is all the other ones You can't say that anyone's deliberately doing anything. But once he's got the insulin ones, he can then reshape all these ones and say, oh, there's somebody definitely doing something. And I know that they did. And I know that they did. Whereas before, without the insulin ones to back up these other ones, he can't say it. And you can't prove it. Can't prove anything. Isn't that odd? Isn't that really, really odd? Sorry if I'm a bit hyped up. Just hearing his voice, because I know what he's done. We know what he's done. We know what he's done. So go back to the recording now from 1720 onwards and see what he's got to say.
Find in a road traffic accident. There was another group of babies who very obviously had been injected with milk or milk and air directly into their stomachs, to the extent that the stomach had blown up. And of course, if the stomach is inflated, this interferes with breathing, because the diaphragm, which is the muscle that regulates your breathing, cannot move up and down. And this was visible on numerous x-rays, where you saw x-rays I'd never seen before or since, where the stomach was a huge great bubble in the middle of the abdomen.
So none of that was picked up in the post-mortem, was it? Plus, for this more technical stuff, there's no point in me trying to relate it all, because you've got to go to the horse's mouth, you know. Not me, I'm the monkey. Go to the organ grinder, Dr. Scott McLachlan, and read through all these aspects of it. What other reasons there can be for air in the system, if there was air there, and it can be related to the result of infection. Then you've got the issue of whether it's reliable to see these things on X-ray at all. He's saying it had to have happened. He's saying it had to have happened. But in the other interview, he says that that you couldn't prove any of it. You couldn't prove any of it in and of itself. And it needs the insulin cases in 2018, a year later, to bolster these ones. Without them, you can't prove anything. Doesn't sound very convincing, does it? You've got this condition called CPAP belly, which is the babies are having this machine they're using, the CPAP machine, continuous positive airway pressure, and that can lead to leakage into the stomach. He's not discounting these things. He's not discounting them. There were no experts there. There was just Myers, KC. There wasn't an expert. I mean, we've got all the information now on the Law, Health and Tech Substack for each case, more or less. There's still a few more to work through. But if you just deal with one of them, this is my idea, I don't know whether people agree. If one of these theoretical air emboluses that's been deliberately caused by Lucy Letby is shown not to be the case, then they all fall. Just one of them. Because the theory goes then, doesn't it? The theory goes for all of them, because they're a type, they're a case. And they apply for the whole range, pretty much nearly all of the charges. The injection of air, or air and milk. They all go, just one of them. So you need to look at, I'll link it, Law, Health and Tech Substack. That's the best place to go. And there's also articles on Science on Trial, and on the Facebook page, Rex v Lucy Letby, in relation to these matters, challenging his theories here. But really, Law, Health and Tech Substack, Dr. Scott McLachlan, that's the place to start looking at. He'll deal with each case in turn. He's still doing them, but he's running through all the babies in turn, you know, and showing that they've all got multiple problems. And we'll see what Evans says in a minute. Okay, just carry on a bit here.
And also there was a load of air in the intestines as well. So that was the other group.
That sort of inflation of their tummies, you've only ever seen that before where there's a blockage. So you've never seen that before related to something where there's not a blockage. So there's no other reason that's happening.
So I thought, now, there are some procedures where oxygen is delivered to premature babies with breathing difficulties via a system of tubes. And that can lead to air getting into the stomach, or more air getting into the stomach. But this is the most commonly used treatment for breathing difficulties in premature babies worldwide. And it rarely causes pressure, because if you do get a bit of extra air in the stomach, the fact that you have a tube from the outside into the stomach would release that air. So it's not a factor that causes deterioration. And then
You're saying it's rare. Well, how rare is it then? This thing called CPAP belly, it's obviously a thing. People are talking about it on Twitter. People who are looking into this case. People with medical backgrounds, nursing backgrounds, doctors. He's saying it's a rare thing to happen. But how do you know it hasn't happened in this case? Plus you've got infection going all around through that ward. All these babies practically being queried for sepsis and other conditions that they have. And there's one that's actually born with pneumonia. And there's a range of other. The best thing I can do, as I say, is to link you to the. Probably many people watching this have started reading the articles of Dr. Scott McLachlan anyway. But yeah, so he's saying it's rare. It doesn't usually happen. They're all just, how loose is all that? So he's gone from something. He's saying, well, that, it's the most common thing worldwide. It happens rarely that there's a problem with it. So because of that, in that very loose way, the conclusion I draw, somebody's doing it deliberately, and there's no other possibility. There's no other possibility, because it's an unusual thing. It's not right, is it? It's weak, isn't it? You can see his processes are weak. You can hear, he doesn't sound like a scientist or a doctor to me. He sounds so generalised, so weak, nothing's really specific. Nothing specific, it's a wash. It's a wash of opinion, with all the other potentialities in shadow, not considered, and he wasn't challenged on them properly. Wasn't challenged on them by another expert. If you would have had Dr. McLachlan there, he would have torn him to pieces, or somebody similar. But he didn't happen in the trial, so he was allowed to get away with that. He was allowed to get away with this nonsense. Like in other trials, he was allowed to get away with, or other situations, he was allowed to get away with saying somebody's got Munchausen with proxies, despite never meeting the person. Despite never meeting them. Like he was allowed to get away in another trial. Well, he didn't get away because the judge said, your opinions are worthless. Your evidence is worthless. A very high-ranking judge says, your opinions are worthless, Dr. Evans. But here there was nobody to do that. The judge wasn't going to do it, not in this case. And there were no competing experts on the defence side to stop him. For the jury to hear that this man is a fool, a charlatan and a fraud. Do a bit more.
And the third group of babies, and the most concerning of all, were babies who'd suddenly collapsed, having been quite stable, requiring a little bit of oxygen maybe, but nice and stable, normal heart rate, normal oxygen levels, and then suddenly deteriorating.
Go to the Law, Health and Tech Substack and start reading through the cases of baby A, baby B, D, E, F, and so forth. And see the range of problems that they had that is in the notes. The range of gradual deterioration over a period of a day, where there's all kinds of markers and signs and notes made about it of deterioration over a period of a day and more, over several days. And he's characterising that. He's lying about that. He's lying about it. If Dr. McLachlan can get those notes, and actually he's stipulating it all, what all the problems were with those babies, all the tests that were being done, all the symptoms that were obviously arising. It's been this whitewash over it, and it happened in court as well. where you've got nurses and doctors they keep saying the babies are fine, they're stable, but all the notes are in conflict with that. The notes made at the time are in conflict with that. You've got situations with doctors in that trial suddenly remembering something, what would it be, 7 and 8 years later, which contradicts the notes they made at that time. So their memory now, both nurses and doctors, individual ones, their memory in the trial 7 years later is fresher, is more reliable, we're asked to believe, than the medical notes they made contemporaneously when it was happening, and B, they contradict some of their police statements as well, which were also made several years before, 5, 6, 7 years before. You can see the concerted effort to reframe these babies as being, there's absolutely no problem. Well, why are they in the neonatal ward at all? Then why are they in the level 2 ward at all? There's nothing wrong with them. But there's a whole host of things, and it's in the notes. And that's how diligently Dr. Scott McLachlan brings them out. And he runs you down. You've just got to read them. You've got to read them. It's absolutely stunning how he does it. And you can see, these are all the reasons. You can see the baby deteriorating over this period of time, because there's an infection working through, and they're getting worse and worse and weaker. And not only that, there's all kinds of gaps in care, in the doctors caring for them, all kinds of gaps in which certain things, for example, antibiotics that were supposed to, a whole course was supposed to be given, and they just don't give it. A baby was supposed to be kept on this CPAP machine to help it breathe, and it was just taken away. You know, I don't want to regurgitate it and reflect all the things in Dr. Scott McLachlan's thing, because there's no point in doing that. You've got to read it from the gentleman himself, who's a highly qualified and experienced man, and it's just he would have been needed on the defence. I mean, it would have blown this fool out of the water. And do a bit more. It's taking a long time, isn't it? But anyway, I've got to do it.
Now, babies who become unwell don't suddenly deteriorate. They will show markers that any nurse or doctor would know to look out for.
They were doing that. It's all in the notes. Go to Law Health and Tech Substack, and the notes. The story's told. You're hearing the story. It's being told to you, that deterioration. The things they're meant to look out for. It's in the notes, and you're being told it. Through the contemporaneous notes. You're being told it. And he's saying there's nothing there. He's just lying, just making it up. He's incredible. There's a I can't remember who did the article. The incredible, I think it was Dr. Scott. The incredible Dr. Dewi Evans. But it's being used ironically. Incredible means not credible, the original meaning of the word. He's not credible. He's not believable. He's not believable. He's there as a hitman. He's there as evidence for hire. He's there to get someone. And as such, in my eyes, he's a criminal. He's a criminal because of what he's done, because of the fruit of what he's done is to destroy lives of Lucy and her family, devastate her friends, and create massive fear through all nurses in neonatal wards across the country. What are they thinking? Anyway, let's have more.
But a number of babies just collapsed, and even more concerning, resuscitation failed to save them, and they died. A couple of them survived, I've no idea.
Well, presumably, and this is what we don't know, I'm not seeing anybody looking to the cases that he rejected of the other deaths. So he would have rejected, as being explainable, he would have rejected, there were 17 deaths over the period that he's looking at, 17. And he's chosen 7, possibly 8 of them. It's because of this 8th murder charge that was dropped. So let's say it's 7. So he's put to one side 10 of them. Well, Weren't they resuscitated? Wasn't an attempt made in any of those 10 cases to resuscitate the baby? Probably in all of them there were. So he's saying in that statement just there, oh, well, they needed to be resuscitated, and then the worst thing was that the resuscitation didn't work. Well, it clearly didn't work. It wasn't able to work because it was probably because of infection. And the poor baby's system couldn't come back from it. Didn't work in the 10 cases that he thought were all explainable. But in these cases, the resuscitation not being successful becomes a matter of a signifier of murder. Does that make sense? Does it make any sense? What we're missing here is more detail on the exact 10 cases, and he lists the reasons why he thinks they're all explainable, and he includes hemorrhage and infection. But in the babies that he does choose, that he decides there's there's murder behind it, then there's hemorrhage there's infection there as well. And there's a lot of issues to do with prematurity as the cause, and diseases passed on, in utero. So, yeah. Anyway, God. Oh dear.
Yeah, how it's an incredible achievement on the part of the team.
Well, baby Em was...
Incredible achievement, yeah, but they didn't manage it on all the other babies they tried to resuscitate. Did they not try to resuscitate the other 10? And they couldn't do it. And there might have been other ones where there was a crash and they did resuscitate and the babies didn't die. But we don't know about those because he's discounted them all. We can't see them. We're told always just to focus on the ones that he's focusing on. And the ones he's focusing on are the ones the police are focusing on. And the ones the police are focusing on are the ones the gang of 4 consultants have been focusing on for the best part of incrementally over 2 years. All the same ones. All the same ones, and everything else gets put to the side. Don't know anything about them. They're all explainable. All explainable. There can be infection there, and it's explainable. But if there's infection here, it's not explainable. It's got to be a murder. Anyway.
Very close to death.
Yes. They'd almost given up to him, and something picked up. And of course, once you get the heart rate responding, then of course he recovered. Now there was one baby who screamed and then cried for 30 minutes. And whilst I'll never be able to prove it, I think the bubble went into the coronary artery, into the blood vessel of the heart, giving the poor babe a heart attack,
And it is very sensitive when you're talking about babies and dying, but he's really going for the emotion there, isn't he? He's the hero there that's brought justice to that baby, rather than it, being potentially a catalogue of doctor errors, the chaos of the unit, the understaffing, the infection that's running through that unit, through that period, and after, and probably before. And it not being able to work as a level 2 unit because they haven't got enough fully qualified staff, not enough nurses, not enough of the right kind of doctors, too junior doctors, all too junior, not able to do the procedures, making mistakes here, there and everywhere. What was the bit he was talking about there? I might have to go back on that. I started rambling.
And whilst I'll never be able to prove it, I think the bubble went into the... Welcome back to...
Oh, that's annoying. I'm going to have to get past that advert.
Screamed and then cried for 30 minutes. And whilst I'll never be able to prove it...
He wasn't there, was he? He's looking at notes. And there's all kinds of contradictions in those notes. Well, what do we know what was said in those notes? Well, presumably, does it say on there he screamed for 30 minutes? Is that what it actually says, or is he just inferring that? We don't know that. I haven't got the detail to... There are challenges to that in people are making on different websites. there are challenges to the screaming in different evidence being given from different people that were there at the time that contend that go against that idea. And how did you know what the cause was? How did you know what the cause was? You'd never be able to prove it. It's all supposition with him, it's all speculation, but it's to an end. Once he's got the bit between his teeth, it is like witch hunting, you know. Once he's got a very small thing, very small scintilla of, oh, that event happened, I've got to hang on to that, and I'll only draw other events in to bolster that up, even though they're not connected. And I'll miss out all the things which will work against my theory. I'll miss them all out. I won't consider those. He's not an honest broker. He's a dishonest, lying fraud. And he's destroyed lives. So he doesn't know that at all. He doesn't know what the cause of that was. He doesn't even know if it happened like that. He's talking like he was there. He's talking like he was there.
I think the bubble went into the coronary artery, into the blood vessel of the heart, giving the poor babe a heart attack.
He thinks it. He's got no proof, got no evidence of it. And then he brings in the emotion, because it will pull people in with the emotion. And it's a very interesting point that he does bring that emotional language into it, because it's an area that he knows absolutely nothing about, that happened. Pure supposition. I heard the scream. It was probably the heart attack that happened. Got no evidence to say it at all. Nothing at all.
You know, which is extremely painful. Another baby
see the reaction they had.
Was found to have air bubble in the brain. So the air would have gone from the aorta to the coronary artery in one case, or to the arteries supplying the brain in another case. But in more cases, because babies are managed lying on their back, the highest bit of the baby is the abdomen. Yeah. Therefore, the air would get into the blood vessels supplying the skin. And this would explain this weird discoloration. The clinical team would have never seen this before or since, and they didn't realise the significance of what they were seeing.
Have you ever seen that before?
No.
The consultants had never seen it before. He's never seen it before. So, where's it come from then? But it's a sign. It's a sign that he then later, 2 years down the line, from just reading notes, can work out it's the case. But he's never seen it before himself. He's never seen it before, and they've never seen it before. That doesn't make sense. None of it's making sense. I'm just utterly suspicious of everything he says. But to really have the medical argument against it, you've got to go to the people who have got that knowledge, like Dr. McLachlan and others. You've got to go to them and look at it, look what they're saying.
In all your years?
Nurses are so methodical, so meticulous in ensuring that you do not get air into syringes. It's second nature.
And if...
Right, okay, so that's something. But it doesn't explain that there may be many other causes for that air to be there, or in fact whether air embolus that he's describing is well, as one of the other doctors, I think it was Dr. Arthurs, said in the court, he said, it's not diagnostic of air embolus, it's not diagnostic of it. He said it could be similar to it, or used another word, in terms of the X-ray result, but it's not diagnostic of it. So it's all on shaky ground anyway. His suppositions from the X-rays, it's all on shaky ground. And even if there are other reasons why that situation could have occurred. And that's what the appeal has to bring. They've got to have a raft of experts to knock him out of the water, because he's just he would be just easily demonstrably torn to pieces on the stand if it was the right people there doing it, with the knowledge to do it.
He's got a line, they flush the line.
You flush the line, and the IV line is put through a machine that not only regulates the rate of fluid, but also has a little sensor. So if any air gets into the line, the bit of equipment stops.
So the reason these symptoms, signs and symptoms if you like, were not recognised for what they were was because it's one of the key things medics try and avoid.
Yeah.
That's what we heard.
I didn't understand that. I did not really understand that. She's saying, oh, well, they weren't looking out for it because they assumed that it wouldn't have been done. It's just all specious argument, isn't it? He's saying there that it's, it's one of the nurses they try to... There's this idea when you're being intubated or the long lines being put in again and again because there was doctors, they couldn't do it right the first time. These various lines going in through the navel area and the intubation as well, is that can actually push air into the body as well. I haven't got all the technical medical terms to my mind. I'm focusing more on the language. I can't pretend to be au fait with all the technical stuff. It would be ridiculous. I mean, I can repeat it, but you need to go to the person who's describing it, and that's the Law, Health and Tech Substack. That's the place I'd go for all of it, actually. That's all you'd need to do. That's all you'd need to do to deal with all this that's being said, to deal with all of it. It's the point that he doesn't consider anything else at all. Anyway.
In the case, wasn't it? The defence made great play of, well, there's no such thing as this air embolus and this rash, and you can't say that it even exists. The point that you made is it doesn't exist because it's completely unethical for anyone to ever experiment on any patient and put air into the circulation, let alone a premature baby, which is why there was talk of that one journal.
We all quoted.
What? It's not about it not existing. It's about whether you can actually diagnose it on an X-ray, isn't it? That's what it is. That's my understanding, anyway. I'm happy to be corrected. It's not the idea that air emboluses don't exist. The defence aren't saying that an air embolus doesn't exist. It's not possible to do it. They're just saying that you can't prove in this case that's what this is the cause of death, and that's what's there from the X-ray. It's not reliable. It's not diagnostic of it. Sorry.
That journal, and I must have read that journal, years ago. It must have settled in that sponge of a brain that I have somehow or other.
Sponge of a brain.
Because from the very first collapse, this is baby A, I looked at the records, and in 2017, a report said this baby's collapsed as a result of air injected into its circulation. The other thing
Yeah, he's talking about that, the record, the article from 1987 on air embolus. And this is the bit where the sponge of his brain has got that in there, but nothing after it. None of the research after it. None of the research after it, which is much more involved and may contradict that previous research and bring it open to question as to whether you can diagnose air embolus from X-rays. It didn't need to do that, did he? Because he's got the 1987 one, 35 years old at the time of the trial. 35, 36, 35 years old, research. And he said in other places, well, neonatal medicine doesn't really move that fast, not much has changed. That's easy for him to say. He's been retired most of that time. He's been retired. So he's got to go back to a time before he was retired. And all these people doing all this research all over the world and putting out these papers that he's never even seen, doesn't even know that exists. He's kind of like brushing that all aside like none of it matters. Because in the sponge of his brain, as he said, he's got that one. And that's all he needs. That's all he needs.
I said right at the beginning, I said, I will identify any cases, i.e. the 15 cases, whose collapse or death I cannot explain as a result of natural causes. And what you need to do if you suspect that this is inflicted harm, you need to look at the nursing rota.
I don't get that. That's interesting, though. So he's going to identify the cases where he can't explain it in terms of natural causes. Then he's just said there he's putting it over for someone else to decide if it's intended harm. He's saying he's sort of separating himself there, isn't he? Oh, I'm not the one that's saying it's intended harm. Whether in other parts of the interview, in other interviews, he's saying, yeah, this is what the person did. They injected the milk. Lucy Letby did this. Lucy Letby did this other trauma to the baby. Did it. He's fully involved, fully invested in the idea that he personally thinks that Lucy Letby's done all this. But here he separates himself out. He just said, oh, I just did this, so it was it's just unexpected, and I'll leave it to you to decide if anyone did it deliberately. Can you see how slippery he is? How slippery he is in terms of what level he's coming in at. Oh, I'll just say, yeah, no, I can't explain it. Well, then that's going no further than the consultants were. They thought they couldn't explain it. That's why they've given the cases to him. But he does go further, and he does it in all through this interview and other places and other interviews. He makes a very bold statement to say that this is what the person did. It's what they did. But here he's separating and pulling back in responsibility. Why would he do that? Why would he do that? Another bit.
And the medical rota for that particular shift. Because if a baby is placed in harm's way, that baby will deteriorate more or less straight away. So this is what they did. They had to cross-reference the day and time of the collapse.
I've said this before in a previous video. It's up to him to come up with that master stroke of genius of looking at the rotors like nobody else could have thought of it. They need him for that. They need Evans to tell them that. You don't think the doctors already know who's on the rotor for all those cases? They already know it. And the police already know it. Everyone knows it, and he knows it. It's this utter pretense. And he's making out as if it's all being discovered bit by bit. And he's coming up with these genius ideas. I know what, we'll have a look at the rotors, yeah, and then what you'll find out then is, you've got to see who's there, and then, but not the doctors, only the nurses. You'll see who's there, and then you might discover who was there. Like everyone's going to be surprised about it. Like the consultants are going to be surprised when they see that, with all these cases with a Lucy Letby crossed by it all the way through. They'll go, oh my God, we didn't expect that. That's strange. We've only been suspecting her for nearly 2 years, 4 of us. We only got her put out of nursing and into an admin role. We didn't expect that to come up. God, a bit worried now, Dewi. God, we really didn't expect that. I mean, we've been punishing her for 2 years, but we didn't expect you to confirm it or anything. And the police go, oh God, Dewi, we didn't expect you to confirm what the doctors had said because, we could have arrested her, and it's hard to say why we didn't really, but we know she doesn't exist and nobody knows anything, and it's a blank slate and everything. It's a blank page, but we could have arrested her, and so it's hard to get across sometimes. I don't know if I'm getting this across. I can't speak from a medical position, but I can infer, as we all can, about language, about the language people use, and when they slip up. When he slipped up there and said, well, all I did was, I just told them these were unexpected, and then I pass it over to you, and I'll just step back while you decide, police, who know nothing about medical matters, you keep telling us, while you decide whether deliberate harm was done. It's nothing to do with me anymore. I just said it was unexplained, that's all I did. But we already knew that consultants thought that. And the police already knew that consultants thought that. Unbelievable. I'll just do a tiny bit more. I didn't realise. I'm probably gabbling. If anyone's stuck with me so far, thank you. I'm sorry.
With the nurses on duty. Even after the first 4 collapses, so these are babies A, B, C and D, there was only one nurse on duty for all 4.
Well, that was the point at which Dr. Britt...
Oh, right. So when is he what position in time is he kind of noticing that from? Because he doesn't know anything about which nurses were on duty. Is he being told that sort of piecemeal, or are the police getting back to him and saying, you know, those first 4 you reported on, well, there was this one nurse on duty for all 4 of them. And the consultants go, oh my God, really, was there? Oh, well, you know, we thought that back in 2015 as well. And we actually told the management that. We told the police that. And everyone knows it. And you're talking now like it's a discovery. Like it's a discovery that's been an open secret in that whole neonatal ward and probably going around other parts of the hospital, especially since Lucy Letby's been told to put into an admin job. Stopped from being a nurse, for which she trained for. And she was great at. And did all that extra training for. That it's a discovery, oh my God. So for babies A, B and C and D, there was only this one nurse on duty. Oh my God, that we've just discovered this now through his work, through Dewi Evans's work. Not through the prior suspicions that have been floating around for over 2 years. It just matched them, that's all. Just by chance. It just matched them perfectly. Like 2 bits of a puzzle slotting in perfectly together. And that's what it is. They're building up a puzzle. And the puzzle has got conviction written over it. And arrest. And imprisonment. And it's a picture of Lucy. Because that's who they're going for. And they've not been going for anyone else since the beginning. They just got the right person for the job, and he can sound superficially impressive to people. Even as a completely non-medical person, my instincts are the flags are going off and off and off, bang, 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 just the mode, the register he talks in, the slipping in and out of the emotional stuff when it's needed, and when it's especially needed, when he knows the least. When he said that thing, I can't prove it, but I think it was a heart attack. No evidence for it. Then he has to pump in emotion to back himself up. It's a confection in his mind, all this. It's a confection and a confabulation in his mind. I'm sorry, this is quite long. I'll stop now, and I'll have to do another bit of it. Thanks for watching, if anyone has, and God bless. All the best. Take care. Bye.